Hi, my name's Jasdeep Tara and I'm here doing my story through CancerStories. And there is hope for everybody. Even though I've got advanced breast cancer, I am living proof that a year down the line I have come through it, although it's been difficult. But you have to be very positive. Your mind has to be very focused, and you have to do what you have to do. It's very difficult for the family. If you're positive, then your family will be positive. You have to help them as well as yourself go through the emotions, go through the treatment that you have to. And if you've got the support, you've got a positive mind, you can do it. But one thing you do have to have is a sense of humour, because if you don't have a sense of humour, it's not worth living. It can be very difficult days. You have lots of downs, but then the ups you have as well. And you've got to laugh. Every day's got to be different, and every day you've got to think, yes, this is my day. I'm grateful for having this day. And through CancerStories, I hope that you'll find my story interesting, and I hope you'll want to watch it and be inspired by not just my story, but other stories that have been there. Hi, my name's Jasdeep Tara. I was born in Nairobi in 1967. We moved to England in 1975. We've lived in Leicester, Watford and Leicester again. I'm married. I've got 3 daughters. I'm a carer for my husband, who's had 3 strokes. I worked at Ashfield School. It's a school for children with learning disabilities, which I loved, but I had to give up to look after my husband. I was diagnosed with cancer on the 24th of February 2014. It was a bit of a shock. It was difficult for the family to cope with. I have been fighting cancer for over a year now, nearly, and this is my story.
Jasdeep, I want to ask you how your cancer was diagnosed. How was it picked up?
Well, I was actually watching EastEnders one evening, and the topic of breast cancer had come up on there. Carol, one of the characters, was shown to have it, and I checked myself, and I found whilst watching EastEnders that I had a lump in my breast. And after EastEnders had finished, I went to the shower and I noticed other abnormalities as well. So what happened was, this was a Friday night. On Monday morning, I made an appointment, an emergency appointment, went to see the GP, and it was a lady, and she said to me, yes, there's definitely something there. I'm referring you to the breast clinic at the Glenfield Hospital. I waited 2 weeks for my appointment to come, and on my first appointment, the consultant checked me, the oncologist, and she said, yes, we're going to do a few more tests. So I had the mammogram, I had the needle injected in my lymph nodes, and I also had some tissues taken from my breast, and those tissues were taken away to the lab to be tested. But on that actual first appointment, I was told that yes, you have got breast cancer, and I'd be very surprised if you haven't. And she left me in the room for a couple of minutes to obviously take up the information, and I thought, yes, I mean, mentally I had prepared myself that yes, I have got it, but I knew there was a lot of research into it, and a lot of work had been done into breast cancer, and a lot of people were surviving it. So anyway, after I had my initial test, I went in a week later. The oncologist there, she checked me and she said, yes, you've got breast cancer stage 2. And then she sent me off to a little room with a nurse called Anne, and we were going through the paperwork, and she says, all right, well, now put you down for a CT scan. I says, but I've already had a CT scan. It was done 3 days later after my first appointment. So she says, oh, I didn't know that. She goes, oh, I need to go back to the oncologist and or consultant and see what she says. And she comes back 2 minutes later, I'm sorry to tell you, but you haven't got stage 2, you've got stage 4 cancer, and the cancer's actually gone into your spine. And she couldn't tell me any more than that, but the nurse was saying, you know, people do survive for a few years, and, you know, the cancer cells are obviously on the top of the bone, which is what I thought, fair enough, it's on the top, you know, as long as I get treatment. I was told that I would get the chemotherapy, I'd be referred to an oncologist at the Royal, and then I'd get the chemo, and then obviously they at that time said I'd have a mastectomy as well. But when I went to see the oncologist, he said I wouldn't be having a mastectomy. Now, I did say, well, if I wanted one after the treatment, could I have one? He said, yeah, it depends on you. But as up until now, I don't think I'm not going to get one, because I think the cancer's spread. That's the reason. I don't know the reason. I have asked, but I've not got the answer.
Do you think you've received enough information, or the way things are being communicated was satisfactory, or do you feel that there's a gap there?
I think there is a gap there, because every appointment that I went to see the oncologist, I was being told different things every time, and I used to take people with me, and, you know, one appointment I was told it was on top of your spine, the cancer cells, and then the next thing I was told it's actually in the spine, you know. So you know, I was getting confused, and every time I went, it was just confusing me even more and more. And you know, it was like being on a roller coaster, because 1 minute you were up, 1 minute you were down, and you didn't know where to go. So I asked a lot of questions. You have to ask a lot of questions. Not all of your questions will be answered, but, you know, it's always a good idea to have the questions there, and, you know, and always take somebody with you, because sometimes you can't take all the information that you're given in, because initially it's a lot of information that you are given, and you can't comprehend everything.
Are you somebody who likes to know the full facts? Or?
I do. I do. I've always said that I'd rather know what's actually happening, you know, not just the bits that you're told. I do like to know, because I have to prepare, because my husband needs care full time, so I need to prepare that, and I need to prepare the children. So yes, I do need to know all the information as it is.
Let me ask you about the treatment. You had chemotherapy, I think. How did your body tolerate the chemotherapy, would you say?
Well, initially, the first chemotherapy session I had was quite awful, because I was continuously being sick on the second day. The first day I was fine. I thought, hey, this is easy. But then by night time, it just set in. I was constantly being sick. My body was going through I don't know what. My temperature was going up and down like a yo-yo. And then the sickness lasted about 3 days, and it started wearing off, but I was very drained. I had a very bad cough, and, you know, and that didn't help. I wasn't sleeping at all. I got constipated, I got thrush. So I got a lot of the symptoms that the chemotherapy talk we had discussed. But after that first initial chemotherapy, I went to see the oncologist before my second one, and I told him, and he prescribed me some more anti-sickness tablets.
Okay.
I lost my hair after the 10 days. Initially, I did have my hair cut quite short, but then the hair started falling out in clumps, so I told my brother to come and just shave it off, and obviously it was like somebody was pulling your hair out, so it's better not to have the hair there, and, you know, it was quite uncomfortable, but that, you know, it didn't really bother me, because it was only hair loss, and, you know, I knew it was going to grow back. My eyebrows, I lost a bit of hair, not so much, and my eyelashes was another thing where I lost not all of them, but I did lose quite a few eyelashes. But as you can see, they've all grown back now. My hair's grown back, although it is a lot greyer than it was before.
How were you about going out when you lost your hair? Did you
Well,
Manage that?
I had to pick my daughter up from school and drop her, so I used to put a headscarf on. And initially, because it was quite cold then, it was quite daunting to go out with nothing on your head. And, you know, even when I had quite a lot of visitors, and when they came, you know, I always made sure that people rang me before they came, and I had a headscarf which I wore like a bandana for a long time. And after a little while, you know, it didn't bother me. So when I was in the house, I started taking it off because the summer was coming and it was just too hot. And even at night, I thought, initially I slept with a bandana on because I thought I might frighten my husband, you know, with a bald head. So, but then I thought, you know, I asked him, are you all right if I sleep with it, without it? And he said, that's fine. But my mother didn't come and see me till my third chemo, and I had to ask my parents if it was all right if I left my scarf on, because it frightens a lot of people to see somebody with no hair. So, and you know, and initially my mum was quite frightened about coming to see me, and this was something that was added, so I had to make sure that she was okay with it. But then after a little while, towards the end of the summer, my hair started growing slowly, so I used to leave it off because I was getting so hot as well. But whenever I went out, I did wear a bandana.
I'm interested to know whether you met any other patients who had their own experience along the way, and whether that influenced you at all.
Yes, I did. After my first chemotherapy session, I was admitted to hospital, and I met a lady there who had been diagnosed with something similar to me, but she was 10 years on, and she said to me, she goes, you know, don't think that that's it, you know. She goes, look at me, she goes, I've done 10 years more than, you know, what they diagnosed me. But also, I've also, through family, met another lady, a Swedish lady who's been fighting cancer for 13 years. Who at the moment is very poorly, but she said, don't give up. And, you know, and she used to give me insight on, she used to say to me, ask lots of questions and, you know, tell them exactly how you feel. And also when you go for appointments, you also meet people that gives you their stories, and that sort of inspires you, and you think, yeah, you know, that's not bad. And initially that was also something that kept me going, that, you know, yeah, these people have survived it. And I mean, in my mindset, I did know that, yes, you know, because I am a fighter, I don't give up easily, but I did know that I would exceed that. And basically, when I went for that first appointment with the registrar, it wasn't actually me that wanted to know the time limit, it was my brothers, really.
Okay.
And, you know, that time limit, it can be less, it can be more, but she did say to me, build up your memories now, because this is your memory time with your kids and your family. And that's something that is very important to remember.
Yeah, I can understand that. But when you're diagnosed with an advanced cancer, obviously it's in your mind, you know, what might happen in the future. Is there any way to kind of live with that, to cope with it a little bit better?
Well, the way I cope with it is say, just be grateful for every day in the morning. And, you know, I always say thank you for giving me another day. And be grateful for all the things, however small, that you have in your life. And also, you know, I read somewhere, or I can't remember whether it was one of the cancer stories, this lady actually, she made little notes of things that made her happy during that day. And although I haven't started writing those things, but at the end of the day, I think about the things that have made me happy on that day. And then that's how you take each day as it comes.
No, those are good tips.
Yeah,
definitely.
because you can't plan for the future. I mean, I learned that when my husband was ill. You can't plan what's going to happen. So you take each day as it comes and just take it from there. You're going to get low days, you're going to get high days, and, you know, you just have to learn to cope the best you can, and every person has their own mechanisms for doing that. So, and talking about, you know, some people don't like talking about their cancer. I like to talk about it because I like to make people aware of what the symptoms and things and what you go through. It's your experiences that will help somebody else.
Plus, if you talk about it, other people can then respond. They can either choose to help you or they can make suggestions. If they don't know, they can't really do that.
Exactly. And also it might raise questions that they might want to ask. Maybe not the same questions that you're asking, but the questions that have, you know, something maybe connected to that question, or
Definitely.
Your experiences, you know. Because life experiences and people that are actually going through it know exactly how you're feeling. You do get people that empathise with you that haven't got a clue, and you know, and you just have to laugh that one off.
Yeah, I guess people have different reactions, don't they? Some rally round, some don't.
Some people don't even want to visit you because they're so scared. Some people, I mean, I've had people ringing me after a long while saying, oh, we were so scared to ring you in case. I says, no, you know, I'm fine, you can talk to me. And my own mother was scared to come and see me, and you know, and I had to say to my brother, just tell her I'm still the same person, I've just got a bit of cancer in me, that's all. My dad actually forced her and brought her after my 3rd chemo.
That's interesting.
Yeah,
you have
and
to
she did,
to get there.
Yeah, and it still is a journey, because even now I've just lost my dad, and you know, and the thing is, rather than my mother consoling me, I was consoling her. So in a way, that was my way of going forward as well. So because I always think positive, I try not to think negative. So you know, she was very negative, and I was trying to make her see the positives of, you know, there's lots of research out there, and there's lots to do.
Yes. The importance of having a sense of humour?
It's very important to have a sense of humour, because I'll give you an example. I used to be, you know, come back from my chemo, I'd be laying there, you know, on the sofa with my blanket, and the girls would be taking pictures of me while I was asleep, and you know, sending me those pictures. And the other thing is, you have to laugh, because it's a very upsetting, morbid thing, having cancer. And if you can have a sense of humour through it, I mean, at first, you know, I didn't find anything funny, because I was just, you know, so numb. But then now, slowly overcoming that, I do think it's very important to laugh. It's important to be happy, to laugh every day. And you do have funny situations. I mean, just recently we were sitting, my daughter and I, and she took a picture of Rasputia, and there's a comical character, and she put my picture next to her. She was showing the older sister, you know, doesn't she look like? And then they showed my husband, and he said no, you know.
They're comparing you.
Yeah. So yes, it's very important to be having a sense of humour, because otherwise life can be too serious, and you can't take serious to that life to that extent.
Do you think that rubs off on others?
It does.
If you've got the sense of humour, does it make things easier on other people?
It does make it easier. I mean, you know, people come, and I've had, you know, when I first diagnosed, I had millions of people visit me, and they were all, you know, I had some sitting there crying, some trying to be positive to me, but also saying to me, you're such a positive person, I don't know how you're doing it. But you just have to carry on with life, and you have to be there. You know, you've been given this life, and you have to do the best you can with it. So, you know, different people cope with having cancer in different ways. But I think it's always a good idea to have a positive outlook, because if you think positive, positive things will happen. If you think negative, negative things will happen to you.
Yeah, well, so, I like your philosophy.
Yeah, you know, so, really and helpful. This is what I try and tell my mum, you know, as long as you'll live as long as you want, as long as you're positive. If you're negative, you're just digging yourself into a big hole, you know.
I want to ask you about a sensitive topic, because I know yours is an advanced cancer. You're quite open about that, but not everyone will handle it in the same way. And one big question is, how do you prepare your family if you know you're not necessarily going to be around as long as you would like? I mean, how open can you be with the family, and also what can you do with them to ease the way they're worrying about it, and also prepare for the future?
Well, along the way I am preparing my children for, obviously I'm not going to be there like We've talked about, when they find partners and, marriage and stuff. And I've said to them that you've got to look into their family backgrounds and, do a simple wedding and thing. And you've got to look after your dad because, as you know, I'm a carer for my husband. But the thing is, it is difficult, but along the way, I always do it in a positive way. I don't dwell on it, but these things have to be said and you have to prepare. Now, I've made my will, which is something that's very important that, everyone must do when they've been diagnosed, because you don't know what's around the corner. Secondly, I know my girls have been through a lot with their dad and with what we're going through now. So it's already made them a lot stronger than any other person, because they've had different life experiences. And I did want my girls to go to university. I wanted them to go out and have a bit of a life, because it's been quite constrained. But I do find that you have to be very positive. Although it's a negative issue, having cancer, advanced cancer, there are things that you have to prepare for. I mean, after I've done this cancer story, my next step is to prepare my funeral, which isn't going to be easy, but it's got to be done, and it's got to be done so the girls know what to do. And, I've got brothers who are quite supportive, and I need to put into place that, things that I would like to be done on my on funeral. But in between, I try and lead my life as normal as I can with the girls. I don't go out as much as they'd want me to, go out with them. They just week before last, my daughter says, "Oh, why don't you come to town with me?" I can't walk that far, and I get quite tired. So in that sense, I do miss it. But then, they have each other to go out with, and now and again we'll go out for meals, for a lunchtime meal as a family, or go to the cinema. Not as much as I hoped I would do, but I'm getting a bit better now, a bit stronger, whereas before I just didn't want to leave the house. I didn't want to see anybody, but then I thought it was quite important to go out with family, because they miss out then. And again, like I've said before, it's your memory time, and these are the memories that you're building up. So going forward, yes, you do have to be quite positive, and it's very difficult. It's not an easy thing to do, but you do have to prepare. It's something that's reality, and you've got to face reality, So that's it, really.
That's very valuable.
Yeah.
Thank you for sharing that. Do you have any words of advice for any other patients who'd be in this situation now? Maybe they've just been diagnosed.
Well, I think it's important to ask for help. If you think that you're not coping very well, like I did, I thought I needed tablets, and I got to see Dr. Mitchell. But I would advise you right from the onset to speak to your oncologist or registrar and say that you would like to be able to speak to somebody, because there is a facility there, and I think it's not well advertised, to be honest with you, and it is a very good facility that you need to take the offer to use, because just by talking to somebody that knows just helps. And then obviously through the diaries that are made, the cancer stories, it just gives you a bit of an insight that yes, you are going through these processes, but this is what, not everyone goes through it, but different people have different cancers, but the generics are the same. You go through, emotionally go through the same feelings. I mean, at first I was quite numb. I had lots of visitors coming, and I just sat there just feeling numb, because I didn't know what to do. And I didn't know how I was going to cope, but I have, and a year down the line I've managed to overcome that. I mean, I still have days where I think, oh God, is this life, but you find ways of coping, and within yourself you find your own ways of coping as well. It does take a long time, and you never totally overcome that fear, and of what's going to happen next. And it's basically the fear of the unknown. And when you go and see the oncologist, yes, they tell you, but it's that you've just got that well, 15, 20 minutes or however long you've got, you know, with the oncologist. And sometimes you have questions, you go away and you come back and you think, oh my gosh, I should have asked that. But then sometimes you think, oh God, do I sound really stupid asking all these questions? Because I remember I went for my second consultation with my Dr. Bianju, and I took my brother with me, and he said to me, you sounded so nervous, and you know, I didn't know what you wanted to know. I said, well, I had to ask those questions because those are the questions that I wanted answers to, you know. And it may sound stupid, but you know, the simplest thing could put your mind at ease, you know. So ask lots of questions, I would say, and because if you don't ask, you won't get the answers. So, you know.
Have you come across any resources that you didn't know were there initially that were valuable?
Well, Macmillan was very good, and the Feel Good Day was brilliant. Yeah, that is a really brilliant day to go out on, because it just uplifts yourself. The wig service at the Macmillan Centre at the Leicester Royal Infirmary, they're really good as well. And obviously I've just started going to the support groups through psycho-oncology with Heather, and well, I've only been to one so far, but they're proved to be quite, well, inspirational, let's say, you know, and it gives you an idea of what other people are going through, and just makes you feel, you know, maybe your problems aren't as big as they may seem. So, and that's it really. And GP service as well. I've got a nurse through Lauros as well, although I've only seen her once. She did say to me, ring me if you need anything, but at the moment I feel I'm coping quite well. Yeah. But in the future I may need it. I've also used Coping with Cancer, and they've actually come in and provided reflexology, not just to myself but to my husband as well. And that was 6 sessions, and they were really useful as well, because because I wasn't sleeping, just helped me relax a bit more. So that's as far as it goes, really. Okay, well listen, thanks for coming in and sharing your story. It's been brilliant to hear your account. I've taken already a lot away from that version that you gave there. So I want to wish you all the best for the future, and keep going. I will. I'm not giving up yet. Definitely. Thanks a lot. Okay.